Hey everybody, thanks so much for joining us on another edition of Will and Friends Live. Today I have a very special guest, Laura Krieger. She's the owner and founder of Heavenly Oasis Massage Therapy, and she's going to be talking to us about things we can be, how we can be doing at home items to be able to take care of ourselves. Because I'm sure we're in front of the computer all day long, our neck, back, all these things are in pain or in some type of not the best condition. And so Laura is going to be able to share with us some tips. Before she does that, Laura, thanks again so much for joining us.
Well, thank you for inviting me. It's a pleasure to be here.
Awesome. For those who don't know you, Laura, can you tell them or share with them a little bit about who you are and what do you do?
Sure. I am a medical massage therapist. I've been in practice for 12 years. I have owned my own business for 10 of those years. I am married. I have 3 grown children, 2 grandchildren. My studio is out of my home here in Fullerton, so I'm very, very accessible. And yeah.
That's great. That's great. Talk to us a little bit about massage therapy. How did you get into it? Maybe some of the certifications that you do have, because in some sense, people are like, can anyone just be a massage therapist? And is there rigorous training that you have to do, certifications or anything like that? Or it's just like, I'm good with my hands. And my mom said I massage her very well, so I can go down that field.
Well, that's part of it is someone's telling you that, oh, you're really good with your hands. You should look into this. Not everybody has that gift. I started this practice or this field late in life, actually. I used to be an administrative assistant for a university. And I loved the people I was working with and I loved the students, but I knew there was something missing. And about 4 years into that, the Lord started, really reaching out to me and pretty much banging me on the back of the head saying, you need to look into massage. You need to look into massage. So I spent our winter break and did some research on some local schools and found a school that was a good fit for me. And the program that I did was a year's intensive course. So I went to school every evening for a year, including Saturdays, while I still worked for the university. I did their advanced program, and that was over 1,000 hours. With the state of California, we don't have licensure, but we have certification. So there are certain requirements that you have to meet for the state. Now you can go to a school and get 600 hours of training, and you're that's like a basic level of massage therapy. I continue my training because I don't want to be, I want to do the best that I can for my clients. I want them to have the best treatments possible. So I continue my education over these last 12 years. I still continue it. I've got my state certification. I have a national certification with the Board of Therapeutic Massage and Body Workers. And so I teach cupping classes as well with that certification. I have my ABMP insurance certification, and then I just have various other certifications from additional trainings that I have taken.
That's awesome. That's awesome. You spend the time to improve yourselves, continue to grow and learn about all the different aspects of massage therapies and even cupping. That's awesome.
Yes, yes.
So Laura, I'm sure you're seeing it all over social media, or just people are reaching out to you in your practice. But people are in pain right now, and because they're working from home, they're stuck at their desk. They're doing these like Zoom webinars all day long, and people are in pain. What are you hearing in regards to that?
When are you coming back to work?
Right.
When are you coming back to work? When can I get in to see you? What can I do? So there are a lot of self-care tips that you can do, whether you're at work like yourself, or you're stuck at home. A lot of times people will have, aches and pains in their neck and shoulders, or they're feeling it in their low back because they're sitting a lot. corporate America, there's a study a few years back that 60% of corporate America has some form of back pain, low back pain, neck pain, shoulder pain. And with the increased use of our tablets and our cell phones and being on the computers all the time, that's a staggering 80 to 85% of corporate America now that's in some kind of pain. So if you can't get to a massage therapist, especially during these times, there's a lot of little tools that you can get. One of my favorites is these therapy balls. They come in a 2-pack, and you can, I'll show you real quick. You can place them, if you're dealing with stress headaches or migraine headaches, tension headaches, you can take these balls, and I like to keep them in the little mesh bag, and you can place them on the back of your head and lay on the floor, and you can just move your head around a little bit, get those tender spots, and just kind of, put some pressure on them and lay on them. You can bring them down to the back of the neck, and you really want to get those muscles that are in the back, the levator muscles, your posterior scalene muscles, because those get, with a lot of tension and stress, those tend to tighten up. You can use one of these balls a lot, and they're stronger than a tennis ball. But
Laura, they look like racket balls.
Almost. They have a little bit of give to them. Okay, so a lot of times people will get headaches, migraines, and a lot of it comes from your jaw, from the TMJ. You can take this and just push it in there and just kind of move it around and really get into that masseter muscle, and that will also relieve a lot of the tension. People will
How long would you do that for? How long would you massage the cheek area?
You could do that for, you could, while you're sitting on the sofa watching TV, you could just get in there until you feel it, and then kind of loosen up.
Got it.
Stretch, move your jaw around, and you'll notice a difference. You can use these on the back of your shoulders. I would lay down on a hard surface, get that in there, and just lay on it until you feel that tension and that pressure start to dissipate.
And we were talking about it a little bit, because I don't know about you, but I know my friends and family, some of us talk about the whole pain versus gain, right? Or we were brought up saying that there's no pain, there's no gain. And so certain times when we do feel pain in some parts of our bodies, we're just trying to tough it out and not really think much of it. But you're saying otherwise, that pain is possibly an indicator of something else.
Right. Your body is just, it's a brilliant piece of workmanship. When you start feeling aches and pains, that's your body telling you that there's something wrong and you need to pay attention to it. People that have, oh, my neck feels a little, tight, I got a little bit of a pain there. The more you ignore it, then you wake up with a kink in the neck. And that's when it has gone too long, where you've ignored your body too long, and now there's this major issue and you have to deal with it. Your body is saying, nope, time out. We need to take care of this now because it's gone on for too long. Yeah, no pain, no gain. I hear a lot of that when people are coming in to see me for a massage. Maybe it's their first session with me, and they are wanting, really deep work done. The harder the better. I like the pain. It's like, well, no, the pain from getting a deep tissue massage or a deep pressure massage is your body telling you this is too much. And the body is going to start fighting against that. So then the body can't relax because there's too much going on.
That's a good point, because that's when people start seeing bruising and things like that.
Absolutely.
Right?
Absolutely.
So what are some things that people can do to prevent the kink in the neck or the lower back injury? Or not lower back injury, but the pain in the lower back area because they're sitting too long.
Okay. So for the neck, one of the things that I do every morning, because when you're sleeping, you're in a position for hours at a time, is I like to take some deep breaths and stretch my neck out in the mornings. And people can do these exercises at home as well, sitting in a chair. You can do them sitting in your office. And one of the things that the techniques that I tell my clients is, especially if they're working and they're starting to feel, neck pain or whatever, take one hand, like I'm going to use my left hand, and I'm going to tuck it underneath my tush, because that's going to stabilize my shoulder. Okay. I'm going to take a deep breath in, and I'm going to take my hand, place it on my left ear, exhale, and gently stretch. And I'm going to hold that for at least 30 seconds. And you're going to feel that stretch. And then I'm going to gently release. You can turn your head to the side and do the same thing, and just pull your chin down to your chest and hold it for 30 seconds and come back up. I'll do that on both sides while taking a deep relaxing breath, because when you exhale, then those muscles and everything can relax. Another little technique, if you're just feeling a little stressed, when we're sitting at a desk and we're on the computer a lot, our posture is not the best. We're leaning forward, our neck is forward, our head is forward, and everything is stretching and pulling. And that's one of the main causes for the neck issues. So sit straight back up, take a deep breath in, and exhale and relax the shoulders. And that puts everything, your neck, your ears, your shoulders, your back, all back into place. It straightens out that alignment and you feel better.
Awesome. You were even also talking about just even simple stretching or just moving of the body, right? Because oftentimes, I don't know about other people, but for myself, I'm just I wake up, I do a few things, and then I'm off to work, right? I'm off to do these webinars or off to just doing work wherever that may be. And I'm not really circulating much of the blood throughout the body. So can you tell us about how that would be even helpful, just walking or stretching?
Absolutely. Again, when we're sleeping, we're in bed for 8 hours, at least. Some people, that's more, but our body is stationary at that time. It becomes stagnant. So if you have pets, people that have pets, what do they do when the first thing those pets wake up? They stretch. Why do they stretch? Because the connective tissues and the fibers in the body start to solidify when we are at rest, when we're not doing things. So the first thing that we should be doing when we get up in the morning is some gentle stretching. Stretch the neck, stretch the back, stretch the shoulders, the arms, the legs. Take 10 minutes, just 10 minutes, and you will see a big difference. And that's all it takes, just a few stretches in the morning. And then, then we go out through our day, walk, get outside, get some fresh air, go for a walk, get that circulation and that blood flow moving and everything. And then stretch again before you go to bed. That's so relaxing if you stretch before you go to bed.
Right. Laura, I would love to see maybe on your YouTube or Facebook, or maybe you already have this, maybe stretches that we can be mimicking. Or if you already have that, feel free to point us to that. And at the same time, are there other resources out there that are good for stretching? Because some people could overdo it. Some people are doing it incorrectly. So are there resources that you'd like to point to for that?
There are a lot of good videos on YouTube. I don't have any yet, but there are.
Not yet.
Not yet. Not yet. I am going. That's in the process actually of doing that. But yeah, I mean, even Pinterest has stretches that you can do. The main thing is when we're doing a stretch, when we're beginning that stretch, we want to take a deep breath in, exhale as we do that stretch. So we can take a deep breath in, exhale, and stretch that arm back. And as you're exhaling, and you're going to feel that stretch, all your stretches you want to hold for at least 30 seconds. That gives the brain and the nervous system enough time to get those messages through to the muscle to say, okay, we can relax. We can let go of the tension and we can relax. And then we bring it back down.
I was like, wow, this was good. At the same time, I was like, wow, I haven't done this in a while. You guys.
Right?
I do it more often.
Exactly. Yeah.
So
But when you are in a stretch, in any kind of a stretch, if you are feeling a sharp pain, you've gone too far in the stretch or you've gone too long in the stretch. So anytime that there is any kind of a sharp pain, you need to stop that stretch immediately, because you don't want to overextend and possibly start tearing a muscle.
yeah, that would not
So
be good.
that's a main key to look forward to, is you want to feel a stretch but not pain. There is a difference there.
Right.
Yeah.
Laura, this is a little bit of a tangent, but I'm seeing the products out there. Maybe they're marketing to me and people like me, but there's a product out there where you just put over your doorknob. It's almost like a hammock, but for your neck, I guess.
The neck extender. Yeah.
The neck
Yeah.
extender. Are those legit? Because like I'm just laughing, thinking like, okay, someone's just trying to fool me. Someone's trying to get me to buy it and videotape it, and they're just
No.
Are those legit?
Yeah. I used to work for a chiropractor, and we use them all the time in our practice. And those really are geared towards people that have issues with the vertebrae in their neck. If they're lacking space, or if they have what's called a military neck, where there's no curvature in their neck. Those items are really good to extend. They lift and extend the neck, creating space in between those vertebrae. And that's what we need, is that space. Because when our disc starts to decompress, start losing that fluid and stuff, then the vertebrae start hitting on top of each other, and then there's no movement. So we want to increase that space, get that blood flow going in there, that fluid going in there, so our neck can move better.
No, I'm glad to hear. I'm still might not purchase it, and yet at the same time, I'll look to your advice to see if I do need that. But besides those products, there are other products you talked about, especially now. I know, Laura, it's a little difficult because you aren't seeing any patients, or you're not allowed to see any patients right now.
Right.
So what kind of products can we be looking to purchase just to have the time pass of the pain, and then once things are lifted, we can go visit you and get it corrected.
Right. So most of my equipment I buy on Amazon, like the therapy balls that I have here. You get 2 in a mesh bag, and you can find them on Amazon. One of the things that I also like to use is, and this is by ProSource, and you can get this on Amazon as well. But this is a Acu pillow, and it comes with the mat. So it's a good size mat.
That looks painful, Laura.
Yeah,
my body's already reacting.
Each little disc has all these little pinpoints on it. Yeah, it looks like it's going to be painful, and it, for some people that it might be, but you gently ease into that. You lay it on your back, and you put that neck roll back here. It gets all of those acupressure points, okay? And it's like having your own homemade acupuncturist with you. You ease into that and lay onto that for a few minutes, and that helps to alleviate some of the pain that you're feeling and stuff. So that's one item. Foam rollers.
Wait, Laura, before you move on to the foam roller, I've looked into those. There's so many different products out there. Is there one to be on the lookout for? The one you just mentioned, but then there's also fake ones, I feel like. Is that the case?
Yeah, I would say, I like the ProSource, because it's the cushion is very soft. So it's not something that's going to be really hard and that has no give to it. Okay. It's got a nice cush to it. That's why I recommend the ProSource. There are some products out there that don't have a good thickness to the mat, and so there's no give to it. And really, when you're buying products, look at you stretching again.
I'm serious. I was like, oh man, this feels so good. Like I did for this side. Now I was like, oh, is my neck messed up? I gotta do this side. Anyway, sorry, I wasn't meaning to distract you from talking.
But yeah, read your reviews. Like I have this little foam roller. This is a tiger tail. And this is great to use. You know, you could use it on your forearms, you could use it on your legs, your thighs. You could even roll your feet on it. Tiger Tail is a good brand for a roller. Okay. There's a lot of different types of foam rollers. Another one that I use when I have some issues with, like, if my my calves are locking up on me or cramping or something, I will take this big guy and I will roll my legs across it. You can get a solid foam roll, and you can use that on your hips, your calves, your thighs. You can use it on your low back, on your glutes. That helps to break down a lot of the stiffness and aches and pains that you might be experiencing. For people that have some neck problems, you can get a foam neck pillow, and it's like a memory foam, and I will sleep with this a lot because it helps with the curvature of the neck. It takes the pressure off. It gives you some more support than your standard pillows would. Another tool that I like to use is my silicone cups. And I use these a lot in my practice, but you can put them on the back of your neck and let it sit there for a few minutes. You can put them across your shoulders and glide them back and forth. Yeah.
And Laura, what's the purpose of the cupping? I see that all the time. I saw Michael Phelps do it, and it's like, oh,
right?
That's the coolest thing. I want to do it too. And then you see all these people doing it, and I don't know why.
Yeah.
What's the purpose?
Yeah. Okay. There's a lot of different benefits and a lot of different usages for the silicone cups. But basically, when you are applying a silicone cup to the body, okay, it has the potential to reach at least 4 inches down below the skin surface. And what that is doing, I don't know if you can see how it's pulling it up just a little bit here. Okay, that is creating space between the skin, the connective tissue, and the muscle layers. That space is allowing the fluid, the blood, and everything to circulate through, and it's creating that space. Okay, so it's starting the healing process, because then that's bringing anything that might be congested in our bodies, like maybe an old injury or something. When people, if you hurt your back, and it's the first time you've hurt your back. But then say 6 months later, you do something and you get a little twinge again. Okay, well, that's a secondary issue. When it happens a third time, that becomes chronic. Okay, it's not just, oh, I threw my back out. That's a chronic issue. So we can go in with the cups and we can do some stationary treatments where we just leave them on for a few minutes, maybe work on the upper part of the back and come back and take them off. We can do sliding and gliding, which is taking the cup and moving it back and forth. And that's breaking down anything that might be congested, allowing it to come to the surface, allowing the body to reabsorb it and flush it out in about 5 to 7 days. I have clients that come in with frozen shoulders that I'm able to treat them with the silicone cups.
Interesting.
Yeah.
Could you be doing it wrong? I know for people right
Absolutely.
now sheltering in place, and they're trying to get that, and they're starting to apply it to their body, and then do it incorrectly.
If someone like you was to go online and buy a package of cupping tools without the proper training, you could definitely cause some damage. Especially if you leave the cup on for too long, you're going to create a lot of redness, a lot of what we call petechia, which are the little tiny red spots that start to come up. And it's basically the little capillaries at the surface of the skin that are breaking. Okay. If someone doesn't know what they're doing when they're using silicone cups, you can overtax your body by doing too much. So when I'm training other therapists, I tell them, start off slowly. Okay. You want to start off, just a couple of minutes and doing light suction. Okay. If you do too hard of a suction and you're working on somebody for too long, you're going to overtax their system and they're going to feel worse than when they first did.
So, Laura, I know we're running up against the time, but with that said, I have a few other questions and I'll let you go. I know you're super busy, so thank you so much for taking the time to join us. For somebody who has the 8 to 5, a 9 to 6, or 8 to 10 hour workday at home, what would be a schedule look like to keep our body flowing correctly, making sure neck and back and all those other items are pain-free in that sense? What would you recommend? What would the schedule look like for you?
For for people in general, or for, I'm not sure.
Sorry about that. I guess I would clarify saying, yeah, for those who are in general, but who are prone to just be at their desk all day long, what would you recommend for them to do throughout the day?
For them, okay. So again, in the morning, you know, if you have to set your alarm 15 minutes earlier, then set that alarm 15 minutes earlier to give yourself some time to get up and stretch. Okay, you need to get some water in your body, and you need to do some stretching and take some deep breaths, get that oxygen flowing throughout your day. You know, if you have to set a reminder on your cell phone or something to get up every 30 minutes and just take a brisk little walk around your office, do that. The more you move, the more your body can move. We see people that are couch potatoes and they, oh, I can't do that because it's too hard for me to, you know, to get up and move around. Well, that's because you're sitting for too long. Our body needs to move so it can move. The longer we sit, the more stationary we become, the more stagnant our muscles become. In the evening, again, go for a walk when you get home, before dinner, after dinner, whenever it fits into your schedule. You know, if that means that you're going to bed maybe 10 minutes later, so be it. You know, you just got to get up and breathe and move until you can get into, you know, make an appointment to see your massage therapist or go get an adjustment from your chiropractor. Both of those go hand in hand. You know, some people would rather, you know, some people don't like chiropractors because it's the cracking, it's the noise, you know, there's a fear there, but actually that's the best thing for you. You know, I tell my clients, come and see, if you have a chiropractor, come and see me first, let me loosen the body, let me get those muscles, you know, relaxed, go see your chiropractor, he can make that adjustment and that alignment stays stronger and longer.
No, I think that's very helpful that you share that. I think, but some people also have the fear that if we go to chiropractors or massage therapists, they're just not fixing the problem. They're addressing it short term, but long term, it's not really addressing. So I'm having to come back to you over and over again, monthly or multiple times. Okay. Well, what would you say to that?
So if you have a chronic condition, that's a condition that has gone on too long, and now it's gotten to this point where you have to make the commitment to fix it. Okay, so yeah, it might take you coming to see a massage therapist or a chiropractor, you know, maybe twice a week for so many weeks. But once we can get those changes in the body going, then we can start backing off those appointments to where we can get you coming in. Now you're doing a wellness maintenance where you're just coming in once a month just to keep things working properly. But in the beginning, yeah, you may have to come in because we can't fix a problem in one session that's been going on for several years or several months.
Yeah, that's very interesting because, like, for those who are the mentality of pain, no pain, no gain. Yeah, this could be happening for a while now.
Right,
it's
right.
A while to sort of unwind or bring it back to normal.
Right, right.
For those who want to just find out, I guess, more information, or like they have pain and they're not certain if they should go to a chiropractor or should go to a massage therapist, what would you recommend?
Reach out. You know, they can reach out to me on Facebook or Instagram or my email, and they can just say, hey, you know, this is what I'm feeling, this is what's going on, you know, I've got such and such pain here, what do you think? You know, it's a phone call doesn't cost you anything. An email doesn't cost you anything. Reach out to someone that you know, whether you know them or not, but, you know, find out, just ask some questions. I am always available, you know, to help you out in any way I can, to answer any questions, and we can go from there. You know, it's like it's a phone consultation. You know, let's you know, figure out what's going on, and then I can direct you from there, where it's like, okay, yeah, that sounds like it's a muscular problem, or that sounds like it may be a skeletal problem, and you should go see a chiropractor.
And then we also have technology, right? We're able to do things like this, where we're able to jump on a Zoom or Google Chat, and it's like, hey, Laura, I'm feeling something back here, or like the pain in the back here. You can show, and then you can ask more questions to diagnose that.
Right. Absolutely.
Awesome.
Yeah. We have more tools available to us at this time than we had, you know, 5-10 years ago.
That's so funny.
Yeah.
Awesome. Well, Laura, thank you so much for your time. For people who want to find out more information or who do have questions, where can they reach you again?
My website is heavenlyoasismassagetherapy.com, and that's my Facebook is under the same title, heavenlyoasismassagetherapy.com. My cell phone, you can reach me by my cell phone, which is 714-496-2485.
Great. And then you're on all the different social media platforms as well.
Yes. Instagram, Facebook, Twitter. Yeah.
TikTok.
Not TikTok.
Not yet. Well, again, Laura, thank you so much for taking the time out of your busy schedule to jump on a webinar with us, giving us really helpful tips. There's very practical things here, things that we can be doing ourselves, simple things like stretching, walking, getting the blood moving, and then certain products that you utilize as a professional that we can be using in the meantime until the lift or the quarantine is lifted. And so again, thank you so much for your time, Laura.
Thank you. I appreciate it.
Hope you and your family stay safe, and we'll hopefully join you, or we'll hopefully do another webinar, maybe talking about a different stretch, or maybe you can walk us through a few other stretches.
Yeah, absolutely.
Awesome.
That'd be fabulous.
Thank you again.
You're welcome.
Appreciate it.
All right.
Bye.
Bye-bye.